Let's welcome Shepherd Price, a daughter of God. Y'all can go back to your seats.
Wendy Hudson is the pastor of North Charleston United Methodist Church in South Carolina.
Why do I care about drug users? Because I know that any one of us can be affected by addiction at any point in our life. We see it in our communities, we see it in our neighborhood. No family can say that drug addiction will never touch my family.
From 2007 to 2011, the number of Americans using heroin increased from 373,000 to 620,000. And for 30 years, injection drug use has been one of the primary drivers of HIV infection in the United States. Dr. Don Desjarlais of Beth Israel Medical Center in New York City is a leading authority on HIV transmission among injection drug users.
We can pretty much eliminate transmission of HIV through sharing of needles and syringes by just getting enough clean needles and syringes out there and getting the used needles back and safely disposing of them.
Decades of research has shown that syringe exchange is a highly effective and cost-effective method of preventing the spread of HIV. Dr. Oxides Barbeau is the health commissioner for the city of Baltimore.
So in 1994, our data shows that over 700 of the new cases of HIV were attributable to intravenous drug use. In the subsequent 18 years that we've had the syringe exchange program in place, the number of new cases attributable to intravenous drug use has decreased by 75%.
The estimated lifetime cost of treating a person with HIV is $488,000. A single syringe can cost as little as 10 cents. Dr. John Auerbach is the former state health commissioner of Massachusetts.
So if we can prevent disease, as we have been able to show we're doing with syringe exchange, we're actually able to reduce the cost of health care. And if we can reduce the cost of health care, that benefits everyone.
And we're not just talking about HIV. More than 50% of drug users become infected with hepatitis C within 5 years of their first injection. And many will go on to develop cirrhosis or liver cancer. This results in roughly 1,000 liver transplants in the U.S. each year, costing as much as $500,000 for a single procedure. You do the math. Kristen Dubé Horton is the Director of Health and Social Services for the City of Bridgeport.
What my hope is that these injection drug users are going to get to a point where they see their ability to take control of some part of their use and realize that they can stop using, and we really become a bridge to treatment.
Have you ever shared a needle before?
Yes.
Have you ever reused a needle before?
Yes.
After today, never again.
Awesome.
All right, that's why I'm glad you're here today.
Awesome.
Currently in the U.S., we're spending about $20 million a year on syringe exchange. Given that the medical costs of a single HIV infection is about $500,000, that means if we prevent more than 40 new infections per year, we're saving money for society. So you do not need to prevent many HIV infections before public investment in syringe exchange becomes a tremendous saving for society as a whole.
Syringe exchange programs in New York City have prevented approximately 45,000 HIV infections since the mid-1990s, saving an estimated $1.7 billion in treatment costs. I'm Peter Hirsch. I'm one of those 45,000. I injected heroin for over 8 years until a syringe exchange a few blocks from here enabled me to seek treatment and then recovery. It saved my life. So please, support syringe exchange programs. They save money and lives.